So we're here today on Capitol Hill as part of a large disability public policy seminar, and we're really here today to talk with members of Congress and their staff people about issues that are important to us in the disability community.
With Medicaid, support services, durable medical.
Front and center today, of course, is the health care bill and saving Medicaid.
This bill is about peace of mind.
When an individual has Medicaid and it's changed their life and they are able to live in the community and work in the community, it has a huge benefit because they are then able to impact their communities. And it's really a reciprocal opportunity here. Evan and Russell, who both serve on their state's developmental disabilities councils, have that opportunity to educate and inform their policymakers about those needs and to influence budget decisions that are made at the state level.
I'm Evan. I enjoy the Georgia Council of General Disabilities.
Evan's happy. He loves his job and he feels like he is really productive every day. And that's a real benefit.
Makes me feel proud. Yeah.
I think the course of Russell's life has been changed by Medicaid. He called me on the phone one day and he said, Donna, Medicaid saved my life. And he explained to me his story about what he was struggling with between his autism and depression. Even though his family had insurance, they didn't have enough to cover what he needed, and certainly not without going into poverty. And so Medicaid stepped in.
I share my personal story because, when congressmen and politicians talk about Medicaid cuts, they usually talk about numbers, but there's a person behind each number, and that person used to be me. And there are people that took my place now that may not get that support. So I think they hear me because I put a face to those numbers.
He really likes to talk with people all over the country. He goes out and speaks to groups. He's very inspiring to individuals who live with autism and all kinds of other disabilities. While no two stories are the same, there are a million other stories out there like Russell's. A lot of people who would lose out if Medicaid wasn't there for them, if they didn't have that safety net to fall upon in really hard times, whether it's short-term or long-term care that they need.
To lead a full life because of Medicaid.
We are asking all of our folks back home to deliver the same messages to their members at home, to attend town hall meetings, schedule appointments with their members or staff who are in the districts, and to keep this message going. Phone calls need to be made, letters need to be sent, stories are being collected, and we're delivering them every day. So we want you to join us in making sure that your voice is heard on Capitol Hill and with your governors and your state legislators, because this is an issue that is all about our lifeline.